In 2012, you may remember we had a great feature in CSWN. It was called They're Watching You. It's creepy and obsessive, and here's how to live with it. Well, that was featuring Catherine Biga, who is here with us today. She is the CEO of CV Management Illinois, or CMI, as they call it. We're talking this time about stick versus carrot. The penalties are here. We've talked about the carrots now for a while. Those are ending. What are you talking about? Because it's rather serious stuff.
It really is. And the federal government probably doesn't like me calling them penalties. They love to call them payment adjustments, but call an apple, it is a penalty. And we have been living it for over a year already. Our e-prescribing is already in a penalty. Our PQRS, our patient quality reporting system, if you didn't report in 2013, you're now in penalty phases. So the bottom line is we've talked about it, and in fact, it's really here.
Well, depending on where they're at in the system, in terms of have they done it, are they still to start, where can they go from here?
Well, they need to go. That's the operative word. They need to get moving. And it really is a very inclusive process. So it's not something you can wake up today and say, ooh, I think I better get going on my quality measures and my measurement. Number one, you have to have a functional electronic health record. You have to have a health record that works for your practice and that you are diligently using and are meeting all kinds of criteria. The thing I think for physicians that is most befuddling is that in reality, they use data from 2 years ago to determine the penalties. So what had happened was most physicians said, you know what, we won't get penalized until 2015 if we don't PQRS. Hey, I've got 2 years. But in reality, you had to have reported in 2013 in order to avoid the 2015 penalty. So everything is like that. Physician value-based purchasing, the value modifier, e-prescribing, PQRS, all those different programs that are really marching us from a volume to a value world are here.
Now, in terms of what they can do with their medical records, just scanning stuff and shoving it into a system is not the answer, correct?
It's not going to work that way. The reality is it is meaningful use, and the only way an electronic record will work is if you can get the data out. So you need to put the data into a structured field so that reports can be written. And that's really what helps us deliver this quality of care to our patients. It also allows us to communicate across different EMR systems so that we all know how we're treating our patients. That's kind of the next phase of meaningful use, is really getting us to that juncture.
There's probably no painless way to do this, but is there a less painful way? Because I can see people shaking their head going, I am so busy now, how can I get this done?
No. What I always say to people is don't view it as an elephant in the room. View it as a really big apple, but you've got to take a bite. And as soon as you start taking a bite, take a step at a time. Most people got through e-prescribing okay? Okay, good. Now get to PQRS. You still have actually about 6 weeks from today to do your 2013 PQRS, so you've got a little window there, but get it done. And then start your meaningful use and go to things like the Summit. I think we're here at the Summit, a very wonderful conference that really gives physicians the lay of the land. We're going to talk this afternoon about up-and-coming things that we haven't even thought about. And I think now we have everybody's attention, because when we talked in 2012, it was just kind of this vague notion, and now it's here. And what we're going to talk about this afternoon is this next vague notion, but it's going to be here before we know it.
Okay, if things crept up on everybody a while back, what is it that you're talking about this afternoon that we need to think about?
You need to think about what is being publicly reported on you. Every physician, every single physician in the United States of America has something out on the internet on them. You owe yourself to go out and look at it, see what's out there, and make sure it's accurate.
It's creepy, and it's obsessive, and it's there. Yes, exactly. So you cannot ignore it.
Nope, and you need to, I would say embrace it, but all the physicians out there would probably want to shoot me if I asked them to embrace it. But I think what it really is doing is it's taking us away from this fee-for-service and treating our patients with evidence-based medicine that the college has been so far ahead in determining what the best patient outcome is. So it is really, truly moving us into a value-based world. Did we get there a little bit bumpy and a little bit unsmooth? Yeah, but I think anything worth doing carries with it a lot of bumps. So I would just encourage you to get out there if you need help. CardioSource has got lots of resources for us, but get started.
There is still some friction with the idea of cookbook medicine. What do you say to that?
No, cookbook medicine means nobody's thinking. Evidence-based medicine means a lot of very smart people not only thought, but practiced and researched. And they have given us the best methods to get our patients to the best outcome. So not cookbook medicine, but doing things that are evidence-based to get us to where we want to go. Very different.
And as the stressful period continues in 2014, do you have optimism that we're going to get through all of this?
Here, this should not be a depressing time. It shouldn't be. It really is a relatively exciting time. I lived in '85 when Medicare came out with DRGs, and we all thought, oh my Lord, it's the end of health care. Well, yeah, but it's just different. It's different. I can guarantee you people are still going to be eating at McDonald's and not wanting to exercise, and they are not going to take good care of their hearts. So they need us to be able to produce and to provide cardiovascular care from prevention all the way through procedures if that's what's needed. So, we can get a little bit depressed because the change, I will tell you, has never been so fast. The change is at a pace, I've been in this a long time, and I've never seen a pace of change like this. But stay with your colleagues, stay up to date, make sure you're reading things, but don't be depressed.
So again, we're at the Cardiovascular Summit here in Las Vegas for 2014. Please see our coverage in CSWN as well as online. For CardioSource World News, I'm Executive Editor Rick McGuire.